Having your blood tested is a common medical procedure that many of us undergo to check our health or diagnose a condition. But did you know that there are some mistakes that can affect the accuracy of your blood test results? In this video, we will talk about the 5 most common errors to avoid before your blood test appointment so that you can get the most accurate results possible. By avoiding these common mistakes, you can ensure that your blood test results are accurate and reliable, which is crucial for making informed decisions about your health and treatment. So if you have any upcoming blood tests scheduled, make sure to watch this video first. Let's get started. Number 1. Not fasting. Fasting is a very common requirement before certain blood tests because it can help to ensure more accurate results. Many tests measure substances in your blood, such as glucose, cholesterol, and other compounds whose levels can be affected by what you eat. If you haven't fasted and you eat something high in those components before your blood test, the results could be inaccurate and may not reflect your actual health status. For example, if you have a glucose test to check for diabetes, eating a sugary meal beforehand can raise your blood sugar levels artificially, making it seem like you don't have diabetes when you actually do. Similarly, consuming a high-fat meal before a cholesterol test can increase your cholesterol levels in the bloodstream, leading to an inaccurate diagnosis. Different tests have different requirements for fasting, so it's important to follow your doctor's instructions or the guidelines provided with your test. Generally, it's recommended to fast for at least 8 hours before a blood test, but some tests may require a longer fast. During this time, you can still drink things like water, coffee, and tea, but you should avoid eating any food. If your blood test requires fasting and you fail to do so, your results could be inaccurate, and your doctor may need to order repeat testing, which can waste time and resources and potentially lead to unnecessary worry or delayed treatment. To avoid this mistake, plan ahead and let your body have enough time to digest before your blood test. This means that you should stop eating solid food at least 8 hours before your appointment and refrain from consuming any calories during this period. This will help to ensure that your blood test results are accurate and reliable. Number 2. Not knowing your medications. Another mistake to avoid before a blood test is not knowing or not telling your healthcare provider about the medications you're retaking. This is because certain medications and supplements can interfere with blood test results and lead to inaccurate diagnosis and treatment. For example, some antibiotics, painkillers, and blood pressure medications can all affect the levels of certain substances in your blood, leading to incorrect results. Certain herbal supplements and vitamins, especially those containing iron or magnesium, can also interfere with blood tests. If you're taking any medications or supplements regularly, it's important to inform your healthcare provider before your blood test. They may ask you to stop taking certain medications or supplements prior to the test to prevent interference with the results. You should also bring a list of all the medications and supplements you're retaking with you to your appointment, even if you think they won't interfere with the test. It's always better to be safe than sorry. If you forget to tell your healthcare provider about a medication or supplement that you're retaking and it does interfere with your blood test results, it may lead to a misdiagnosis or inappropriate treatment. This can cause unnecessary stress, anxiety, and potential harm to your health. Therefore, it's crucial to be prepared and communicate openly with your healthcare provider about all the medications and supplements you're retaking before your blood test. Number 3. Not checking your latex allergies. Latex allergies are becoming increasingly common and can cause serious reactions in some individuals. If you are allergic to latex and do intend to inform the healthcare provider or lab technician performing your blood test, the allergy could go unnoticed and lead to a severe reaction. Latex is commonly found in gloves, tourniquets, and some adhesive tapes used during blood draws. Exposure to latex can trigger a range of reactions from mild skin irritation to life-threatening anaphylaxis. If you have a known latex allergy, it's essential to inform your healthcare provider or lab technician beforehand. They can take steps to minimize your exposure to latex by using alternative products such as non-latex gloves and finding another tourniquet option. If your blood test is performed at a lab, You might want to contact them beforehand to discuss your allergy and the precautions they have in place. Most labs are aware of the issue and will take the necessary steps to ensure your safety. By checking for latex allergies before a blood test, you can help to ensure a safer and more comfortable experience for yourself and the healthcare providers. It's important to note that even if you don't have a known latex allergy, it is still a good idea to check with your healthcare provider or lab technician about their safety protocols and whether or not they use latex products. Some people may develop an allergy over time or may not be aware of their allergies. Taking these precautions can help to ensure the safety of everyone involved in your blood test. Number 4. Not staying hydrated. Proper hydration is crucial for several reasons. First, it helps to ensure that your blood is sufficiently diluted to accurately measure the concentrations of certain substances. Dehydration can lead to higher than normal levels of substances in your blood, resulting in inaccurate test results. Additionally, dehydration can cause your veins to shrink, making it more difficult for the healthcare provider to find a suitable vein for the blood draw. This can lead to multiple attempts at finding a vein, which can be painful and frustrating for both you and the healthcare provider. Furthermore, being dehydrated can make you feel unwell and lightheaded during the blood test. This can be dangerous, especially if the blood test needs to be performed at a lab, where you may need to walk or sit up after the procedure. To avoid these potential issues, make sure to stay hydrated before your blood test. The amount of water you need to drink will depend on various factors, such as your overall health, activity level, and the weather. However, as a general rule, it's a good idea to drink at least 8 ounces of water a few hours before your appointment. You should also avoid drinking excessive amounts of water right before the test, as this can lead to a false dilution of your blood and inaccurate results. In addition to drinking enough water, you should also consider the timing of your last meal and caffeine intake. If you've recently eaten or consumed caffeine, it may be harder for your body to absorb water effectively. Therefore, it's best to allow some time between your last meal and your blood test to ensure that your body has had enough time to process the food and caffeine before becoming hydrated. By staying hydrated before your blood test, you can help to ensure that the procedure goes smoothly and that you get the most accurate results possible. Number 5. Not allowing enough time to recover. Allowing enough time to recover after a blood test is often overlooked, but is an important step that should not be rushed. Many people try to drive themselves home after having a blood test, which is not only unsafe, but can also lead to complications. When you have a blood test, a needle is inserted into your vein and blood is drawn out. This can cause some discomfort and lead to feelings of dizziness or lightheadedness. Driving while feeling unwell can be dangerous not only for yourself, but also for others on the road. It's important to allow enough time to recover before attempting to operate a motor vehicle. Most blood testing facilities will have a waiting area where you can relax for a few minutes after your test and make sure you feel well enough to drive. It's generally recommended to wait at least 5 minutes after a blood test before trying to drive. However, this may not be long enough for everyone. Some people may feel dizzy or lightheaded for longer, and it's important to listen to your body and not try to drive until you feel ready. If possible, it's always a good idea to have someone else drive you home after a blood test, especially if you are having multiple tests or if you are taking certain medications that may affect your blood pressure or vision. By allowing enough time to recover after a blood test, you can help to ensure your safety and the safety of others. It also allows your body to process the blood draw and minimizes the risk of complications such as fainting or injury. We hope that you found this video helpful and that it will help you avoid common mistakes before your next blood test. Remember, your blood test results can provide valuable insight into your overall health and well-being. So it's important to do everything you can to ensure that they are as accurate and reliable as possible. Thank you for watching, and we wish you good health and well-being.